Welcome everybody. My name is Maeve Hulley. I am the Director of Volunteering at Helpforce, and you're all very welcome to this, our first ever masterclass. So we're very excited about that. Very excitedly entitled Unlocking the Potential of Your Volunteer Service. A little bit of housekeeping before we start. If people could keep their cameras off, that would be really great, because we're conscious just of the internet and the bandwidth. And if you could also stay on mute unless you're speaking, that would be really helpful. On the side, you'll see our chat function, and rather than invite questions as we go along, we'll have a question and answer session at the end. So please pop your question into the chat, and Melissa, who's on the call, is going to be collating all of those questions, and we'll get to all of them. We'll aim to get to all of them before we finish. If there's any outstanding, then we'll take them away and send out the responses to those questions. The session is being recorded, and the recording has started already. And finally, in terms of housekeeping, we're going to assume you're happy for us to be in touch with you after this event, unless you let us know otherwise. So if you don't want us to contact you, then please drop us a note and just let us know. Otherwise, we'll assume that you're happy to do that. Great. Okay. So what are we going to do over the next 57 minutes or so? So we've broken up this masterclass into two parts. In the first half, we're going to talk about 4 key components of Adopt and Adapt. Those of you who are familiar with our work will know that the real magic of the work that is about creating volunteering interventions that we can scale and spread elsewhere. And so that part of the session we'll be looking at in a wee bit more detail. Max is going to walk us through what we mean by Adopt and Adapt and what it means for some of these particular projects. We're also today inviting you to get sight for the first time of our new blended service delivery. So that is a mix of what traditionally we have done, which is program manager support, but alongside a digital service called Rise that we are sharing with you today. And we'll spend a wee bit of time looking at that also. Then we're going to have a live case study. We've already used some of the blended approach for some of the voluntary to career, and Rachel Higgins from Shrewsbury and Telford Hospital has really kindly agreed to share with us her experience of that, of what has worked, maybe what hasn't worked, and generally her experience of the Helpforce blended approach. Then in the second half of the session, we're going to look specifically at the volunteer services that health and care organisations are most wanting to adopt, and that's based on some of the research we've done around information we've got, downloads we've had from our service guides, general inquiries, and so we'll share them with you. And then really exciting, we'll tell you about the next steps and how you can secure a place on a Helpforce Adopt and Adapt courses, which we're hoping to start before the end of July. So that's where we are. For those of you who I know some of you will know some of us, and some of you won't know any of us, and some of you will know all of us. But just as a bit of a reminder, just want to introduce you to the program management team. So Max is going to be doing most of the talking today. Melissa's going to organise the Q&A. Mark has been working with Rachel on the volunteer to career, and Sarah is going to tell us a wee bit more about the blended service when we get to it. And Beth, for her sins, is on a flight to Bali, so she isn't joining us at all today. And we also have Sam, who's there today. She's helping us with all the technology, but Sam has played a huge role in helping us develop the content for the Rise. And Debbie, who I'm sure most of you know as well, is here and is helping in the background with some of the technology, and we're keeping our fingers crossed that will all work. So sit back and enjoy, and as I say, we'll pick up questions near the end. Max.
Thanks, Maeve. And for those of you who do know me, it is of no surprise that I'll be doing a lot of talking. But there we go. So look, I wanted to introduce to you all the Adopt and Adapt service. Some of you have used it before, but in different guises, where we've done a lot more one-to-one direct support with you guys. This service doesn't take away from any of that one-to-one support, but actually enhances it. And about adopting a new volunteer programme, one of the things that we know is it's not easy. And one of the skills that we bring to the table that we're able to support you with is how we can actually best help you to adopt and adapt new services and make sure that they're sustainable moving forward. You'll get used to, as I speak, I'm generally not necessarily going to talk about the information. I'll talk around the information on the slides, and feel free to just read as you go, and please put any questions in the text. So why do we do adopting and adapting? Well, it's tried and tested. So somebody else is going to make the mistakes on your behalf, so you can step over and actually expedite the safe delivery of new services. So it massively reduces risks, and because there's evidence of what the delivery potential is, actually it means it's quite a helpful sell up to your senior teams in terms of why these services are so valuable and why you want the organisational support to do it. We have worked with a lot of organisations, and I think last year alone, probably 80 or 90 Adopt and Adapt projects that we worked and supported you on. We've got now quite a lot of expertise in what works well and what doesn't work when you're learning to adopt and adapt. And certainly one of the things that we have found out is that there are some key pillars that you need to think about when you're adopting and adapting services, and some of them are more are duller than others. Some are quite exciting, but the 4 key components of adopt and adapt are agreeing a project scope, effective stakeholder engagement, think big but start small, and the outcome model. And I'm going to go into each one of those separately. So in terms of agreeing a project scope, I think it's quite interesting, and if you can see from the picture, what you start to do and what you mean by a cycle route sometimes ends up being used for many things other than just a cycle route. So one of the things with a scope document and getting a clear scope of works set out ahead of starting to develop your project is actually about clearly defining the boundaries of your project, what it is and what it isn't. And it may well be that over time, you're happy for people in mobility scooters to use your cycle lane, but actually at first, when you're testing and piloting, you want to be quite clear about what the parameters are, what's in scope and what's out of scope. And this is really going to help you in terms of your thinking and planning, help you with your stakeholder engagement, collaboration, and absolutely helps you keep your project on track. And most importantly, that scope creep, that's the bit that generally knocks people when they're starting to set up or take on an existing project or build a new project, is when those little bits and bobs keep creeping in, which actually can send you off kilter, and then you find you're not developing the service you thought you were, or you're not able to evidence what you wanted to in order to secure additional funding. Within our Helpforce Adopt and Adapt service, in our online programme, we've now got some really helpful templates and learning modules all around how to write and create a really good scope document. And actually one of those things is doing that in line with your stakeholders so that they are all bought in, and then you have this document that says this is what we're all going to do, this is what it is, this is what it isn't, this is what we're going to measure, and you're more likely to get a better impact as a result. The second pillar is effective stakeholder engagement. Now, the first tool, stakeholder engagement, I mean, we could talk about that for about a week, I think, in terms of the complexities that sit around effective stakeholder engagement. In terms of setting up a project, it's absolutely essential that you identify and understand who all your stakeholders are. Now, different stakeholders have different roles within your project. Some are, and if any of you have heard of the term RACI, which is who's responsible, who's accountable, who do you communicate with, and who do you just inform. That's one way of defining your stakeholders. But by understanding who they are, you can start to think about right from the start of your project at project scope stage, you can start thinking about who you need to engage with, who needs to be involved in workshops, who you just need to let know that this stuff is going on. But the fundamental bit is that you're taking your stakeholders on a journey with you. And don't underestimate, I guess, the time it takes to do that identifying, having those conversations to bring people, to get people aligned, the complexity of some people will not see the value in your project, and overcoming all those different aspects of stakeholder engagement. But actually, in this sort of project approach with Adopt and Adapt, as with any sort of project design, it is front loaded. It's front loaded with getting yourself organized and sorted, and stakeholders is a great way to do that. So as a result of spending that time and investing that time, you get their buy-in, which will reduce barriers. You might not even know what those barriers will be because you've had those stakeholder engagement. But if you haven't been engaging with people, you'll soon notice the barriers as and when you come to implement your project with staff members that aren't keen to refer to your service, that sort of thing. By getting their support, you're also removing barriers, helping with sustainment. It'll help you get your project integrated into your organisation better. And certainly over time, that's what you want to be doing. And certainly within our courses, what we talk about is how do you take your service from feeling like it's something that sits on the outside of things, doing its own work, but actually we take the project up and lift it and pop it right in the heart of your operations of the hospital or the healthcare or the community, wherever your environment is. So all of these things are worth investing in, that's for sure. The next one is think big, start small. And I was very pleased and smug with myself when I found this photo, because it is absolutely exactly that. Front load, take your time, understand, write a good scope, take the time to identify your stakeholders, but also you've got big aspirations, but start with a manageable amount of delivery. Understand what the potential of the demand for your service is, but actually what's manageable for initially, because the bit about starting small is that you will learn. The minute you go live with a service, if it's with 1 volunteer, 2 volunteers, or 5, you will instantly learn, well, that process doesn't work. This one needs to be a bit different. We could do with tweaking that. I didn't realise that nobody was going to actually fill out my volunteer request form. Do you know what? We're just going to use the phone. Whatever those different scenarios are, starting small, reduce the risk. It helps you learn, and then you can incrementally grow your project after that. And part of starting small is collaborate and learn with your stakeholders. Again, don't do that in your bubble. You've now built up this great group of stakeholders that you're working with. So what's now is really important is to take them again, keep taking them on the journey. This is what we're finding. What do you think? Is there a different way of doing it, etc.? It is referred to as PDSA in the world of some of your worlds, but basically there is an approach called that is all about observing, testing, tweaking, and doing it again. And that's a process that you should be doing, that sort of incremental changes as you go. So that is what Think Big, Start Small is all about. And finally, the fourth pillar, you're all probably thinking, thank goodness for that. I hope there's no more pillars. There are only 4, is the outcome model. Again, front loaded, understanding what your outcome model needs to look like, what you're going to be considering in terms of measuring, who the beneficiaries of the project, the service are going to be. And again, using your stakeholders to get their buy-in and understanding that this is how the measurement for this particular project and service is going to work, and produce an outcome model. Understanding this right up front, before you get volunteers on the ground, is going to help you make sure that you've got the processes in place to be collecting data. Sometimes it might be volunteers collecting the data, sometimes it might be the volunteering team. Who knows who might be, or what systems are you going to use? Is it going to be spreadsheets? Is it going to be your volunteer management system? But whatever it is, the thinking goes up front, and that way, you ensure that from day one of your project, when you go live, you are going to have insight from day one, and using your data to help you identify better where and what's going wrong and right with your project. Data is the best place to look, as well as, of course, talking to your volunteers and your service users. But it's a really great tool to have right up front. And then it leads you to sort of better and more robust evaluation data because you've started from the beginning. Now, I've got a really good example coming up to show you, which is from University Hospital Coventry and Warwickshire. Now, they've used this approach really well with setting up a response volunteer service in their acute hospital setting. Lots of stakeholder engagement up front. In fact, the RV service had, before it even went live, had a working group of clinical leads, generally ward managers and nurses, who had identified as part of collaboration what the response volunteer tasks were going to be. And as a result, I'm going to share with you, and as of them capturing data and all sorts, I'm going to share with you a snapshot of their dashboard that they send out. Now, it's a bit of a busy slide, and I've put some highlights in to take you through some of the information. So this is a response volunteer dashboard. What this is saying is that there are impact measures. So as a result of capturing the data, understanding how they were going to capture the data from day one, they were able to identify the number of patient contacts they had, that patient support. And in this period of 6 months, they've had 11,000 over 11,000 patient contacts. That, as a result of that and collecting their data, we are very aware that that translates into productivity gains. And now, by having this data, they're able to use this dashboard to share it with their peers, with boards, to get further investment and support with their volunteering. So productivity gains, 1,185 hours, which actually, depending on what currency you like to talk in, for an organisation, that's 33 weeks worth of additional capacity into the organisation. Most of you probably do a lot of this already, but the ability to demonstrate it so clearly is a really important part of this. I don't know if you can see my cursor there, but under the demand tracker, you can see how in December, when the project started, as we just talked about, they started small. They started with a handful of wards, but a clear direction, and they got a couple of hundred worth of tasks identified and volunteers doing that, providing that support. And you can see how it grew for the second month, third month, and then as it moved into February, the service broadened across multiple wards. And you can see at that point, we've got this really continuing and sustainable delivery across a huge volume of people. So when I'm looking at that, you can see from a demand perspective, this is a sustainable service. This is going to work, and that's happened quite quickly. This bit jumping here and then jumping up to the in February would not have happened without the upfront work of that stakeholder engagement. We can also see in this next one here that actually where all their requests are coming from. So they get requests for volunteers for pathology runs, which is taking up the main thing. So with a head-on about managing the programme, having my data, I can really easily see that actually there is a clear demand for the pathology stuff, but actually there's room for growth potentially elsewhere as well. And what's also great is we can see that actually they're achieving 99% rate of tasks completed out of those that have been asked. And just to very quickly mention at the bottom there again, in terms of the supply, which is your volunteers supporting the service, in this monitor here, we're able to identify what are your busy days, what are your busy times, which actually in terms of how many volunteers you've got, how you do your scheduling, is a really useful and helpful piece. So that for me is that second part of outcome model. We've got make your plan of your project scope, take your time, get your stakeholders engaged, start small but steady, and then build up your service incrementally. And with your outcome model already designed and in place from day one, you'll be able to track and be able to use a dashboard similar to this to support the development of your project. Okay, whistle-stop tour of that part done. I'd really like to talk to you. Maeve mentioned at the beginning of the session that we've started a new way of working. It's a blended way of delivering our services. And we use a combination of program managers, online e-learning, and online peer group support as well. And I'm feeling, am I going to do it? Okay, I'm going to show you. I'll show you the live system. But basically, when you join in a program with Helpforce to do an adopt and adapt now, you'll get your own account area with the courses, with a service guide, digitized service guide, and the relevant courses assigned to that service guide to provide you with the upskill you in what you need in order to deliver the various steps of an adopt and adapt program. So we've got your account area. When you click in there, you then have your list of courses, and then you have your e-learning, which is the platform that we use is probably one of the best in terms of interactive and engaging platforms that you can use. And importantly, all this content and information is done in the context of the health and care environment. So there's project management, volunteer management, there's understanding supply and demand, there's service guides, but all of it is written with examples that understand the context of volunteering in a health and care environment. And that I've decided I'm not going to risk it and go out into the live system because it'll probably just go wrong. We're going to move on to the next slide. Next slide, I'm also not going to talk through hugely. This is the features and benefits of Helpforce's online new way of supporting our clients. It's an information sheet. So when you get these slides sent to you afterwards, this will be part of helping you hopefully decide whether you feel this is a good opportunity for you to benefit from some of this work that we've got for you. So I'm going to stop and hand over to Mark.
Thank you, Max. So I have a shorter presentation slot, and I have the great pleasure of introducing Rachel Higgins from Shrewsbury and Telford Hospitals NHS Trust, who is the Public Participation Facilitator and VTC Project Manager. And Rachel and I have been working together for a few months now, and Rachel's been working through the new Adopt and Adapt blended service that Max has alluded to, and has very kindly offered to come along today to talk about her experience and Shrewsbury and Telford's NHS Trust experience of embedding their new volunteer into career programme, accessing Helpforce's Adopt and Adapt service. So without further ado, I'm going to hand over to Rachel. Rachel.
Thank you, Mark. Hi, good afternoon, everybody. Mark's done the introduction for me, so very kind of you, Mark. As he's explained, I'm the volunteer lead here at the Shrewsbury and Telford NHS Trust. I'm also the Volunteers to Careers lead. So very briefly, sort of my background, I've done various project work, not previously with Helpforce, and I was in February time seconded to help with the Volunteers to Careers project. So briefly, the background of our programme here at Shrewsbury and Telford, we've created a Volunteers to Careers programme which provides provides and helps a direct route into the maternity sector. So it's ideal for people who are perhaps interested in a career in midwifery and would like to try the role out to see if it's for them before they perhaps go on to further study or maybe sort of a change of career. So our programme is completely free. They don't have to, our volunteers, the cohort don't have to pay for any training. They just need to volunteer their time at the trust. What we ask from our volunteers is a commitment of 50 hours. So that can be over sort of 5 to 6 months. And alongside that, the project, we have the mentor support, the pastoral support, the pre-employability or pre-educational support as well, in which our volunteer to career volunteers are supported each way by our clinical lead, who is also another Rachel, and she's the mentor who provides CV writing skills, interview tips, techniques, hands-on experience. So that's a very, very quick sort of idea and background around our project. We launched our first cohort in April, which we have 17 volunteers on, and we're currently recruiting for our second cohort, which are beginning to start in September. Now, the reason I've told you all of that is we're quite proud of what we've achieved here at SAF. And we believe that the success to the project is genuinely down to the system that Maxine has gone through very quickly, very briefly with you all today. So that is the adopt and adapt blended approach. So from a practicality point of view, as a current service user, and it's always there to refer back to, it's not you do the courses, you do the e-learning, and then you never go back to it. It's there, it's a constant source of resource for us. So from a sort of a user point of view, I just want to tell you very quickly about the things that I found that have really benefited us here at SAF, and the modules, how they've helped with implementing a very successful Volunteers to Careers programme here. So Maxine also mentioned how user-friendly it is. It is engaging. It is extremely engaging. As we're all sort of from a healthcare background, you know, when you go onto your e-learning for health and you have to do your mandatory modules or mandatory e-learning, it's not exactly the most engaging or enthralling platform. Well, I can assure you this is what they've created, the programmers behind it, super user-friendly. I'm not a particularly technical person. Extremely dynamic. When it's a shame we didn't get to have a look at the site, but it's got all the bells and whistles. There's videos, there's quiz, there's click cards that turn around. There's sort of standout boxes, the top tip areas. They give you some real life scenarios. It's colourful. It's a resource that I can go back to at any point and refresh my memory. It gives you a progress tracker and time notes, so you have sort of an idea as to where you're at in terms of the courses and the learning. Really easy to use dashboard. Maxine showed you it just before up on screen. So from a navigation point, from an engagement point, it's super up there. I was very, very impressed. In terms of how it has helped me, we've gone through very briefly, thanks to Maxine, the project scope. I am a Prince 2 practitioner and facilitator, and this has helped me more in creating a project scope document than any of the learning I previously done with Prince 2. So I learnt more genuinely, hand on heart, from this platform than I did when I went and did my Prince 2 qualification. It's just giving you that understanding in sort of real terms. You can tell it's written in a way, and Maxine once again mentioned it already, with the healthcare setting in mind. So any examples, any top tips, it's all tailored to the industry that we're in, and it is a step-by-step guide. Without, I think, the templates, the resources, the content, I think it would have been hard to keep the project scope on track, and the structure perhaps would have gone off on a slight tangent. Whereas, you know, the content, it's keeping you in line, you know exactly where you need to be and exactly what you need to do. It's also helped me think in a slightly different way. When you are creating a new project or a new volunteer service, it can be quite easy just to go into it sort of all guns blazing. This approach has given me the opportunity to really take those bite-sized chunks and go back to it, give myself a break, come back to it again, and it's to structure a project. And I genuinely believe it has reduced any risks. Any risks, that's probably quite a broad statement, actually. Most risks associated with creating a new project or volunteer service. We did at the beginning, we had quite a lot of peer-to-peer support. So that's not only from Helpforce, but also volunteer leaders across the UK to share ideas. It gave us an idea of how the project and how Helpforce were going to support us and the roles they played as individuals. And they gave us a background of the resources available to us, the benefit and best practice. And it's enabled us to have a sort of a very strong network of volunteer leaders that we now sort of meet monthly. And it's fantastic. Beyond sort of the adopt stage, we've had a lot of support from Mark, from Beth, who's not here, lucky thing, in Bali. Honestly, it feels like sort of a warm hug. There's been so many times I've fired off an email to Mark or one to Beth saying, help, I need some support with this. And they come back to us very, very quickly, very friendly, with constant sort of email support and one-to-ones if that's what we've needed. They're always on hand to answer any questions that we have. On the platform, there's also opportunities whilst you're creating project scope documents or creating a new service, new ideas, to submit your documents or submit plans, whether it's Gantt charts or whatever it could be. And they will come back to you with feedback, which is a fantastic tool to have. So they will come back to you and let you know any tweaks or adjustments needed, which has been fantastic. And we have the Teams channel as well, which has been extremely useful for people in the same position as myself, being able to keep in touch with one another. So I would say to sort of anybody, I genuinely believe that the resources, the blended learning approach, everything that we've had from this platform has helped create the project that we have here at SATH, and why it's been so successful, meaning that, you know, we're going on to cohort 2. And I think without the help for me to be able to create such a dynamic project scope document, I don't think we would have received the sort of board level buy-in and stakeholders that we've had. And Maxine mentioned previously how important that stakeholder engagement is. So I wouldn't say the project's been smooth and seamless, but it has certainly helped along the way. And if anybody wants to ask me any questions at the end or wants to get in touch with me outside of this meeting here today, I'd be more than happy to answer any questions about the platform or indeed the project here at SATH. Thank you.
Gosh, thank you, Rachel. And can I just say to everybody, I promise you we didn't pay Rachel a large amount of money to say all that. That's completely off that's completely off the cuff. So
I came to you when I first used the platform and said what a breath of fresh air it was compared to some other platforms that we use in our day-to-day roles. Just completely different. Completely different.
Thanks, Rachel. And as to the photos you've been looking at while Rachel's been talking, those are the first cohort of volunteer to career volunteers that started at Shrewsbury and Telford. And my colleagues are fed up with me going on about it, but the photo in the middle there is volunteer to career donuts that all volunteer VTC volunteers had when they started. That's yeah.
And they went down a treat.
Yeah, they did indeed. So I just wanted to say, yeah, seriously, thank you, Rachel. That was brilliant. But also to say, from a Helpforce perspective, wanted to let you know that we also, program managers, are very available. Rachel's alluded to it. You can reach out to us with regards to organising one-to-one clinics, which many of myself and my colleagues run often, for those working through the course, but also group clinics, as we recognise the importance and the value of enabling that peer-to-peer culture of support. And I think from the feedback surveys that we've done around introducing our blended service, it's been interesting in the fact that that's been one of the sort of major high-end scoring benefits is enabling that peer-to-peer. The other one, which we haven't talked about, is the confetti moments that you experience when you're going through the modules. Every time you finish the program, of course, you experience a confetti moment, which also scored highly on the feedback as well. Worth noting. So I'm going to close this session now, and I'm going to hand over to my colleague Sarah Miles, as Maeve introduced at the beginning, fellow program manager. And Sarah's going to talk about why certain volunteers services are in demand, and potentially how you could secure a place on our upcoming Helpforce Adopt and Adapt course starting in July. Over to you, Sarah.
Brilliant. Thank you, Mark, and thank you, Rachel, as well. Really, really good to hear how you've experienced the platform and the service. I'm going to talk to you, as Mark said, for the next sort of 10 minutes or so. After me will be the Q&A. So if you're hearing things at the moment about the Adopt and Adapt programme, about how it works, about what we do, that you have a question about, do start dropping them into the chat, and we'll start fielding them ready for the Q&A section in 10 minutes' time. So we, as an organisation, look a lot at our data as well to try and understand what the demand is for our services, what we're being told by the people that we work with, what the visits are to our website, and what is of most interest to people. And you can see on this graph here, this is our data just from last month, so really kind of up to date, what the activity is looking like and where some of the demand is that we're seeing in terms of the different volunteer roles. So we've got discharge there, response volunteers, mealtime companions, emergency department volunteers, and then volunteer to career as well. So a lot of these, particularly those ones, ED, mealtimes, response volunteers, they are large scale kind of high impact volunteering roles. And I'll tell you in a minute about some of the impact those roles have had and some of the evaluations that we've supported. There really are identifying some of those pressure points, particularly around discharge and where response volunteers can support to try and do some of those discharge tasks and help people to hopefully leave the hospital that bit sooner. They help to identify some of those workforce gaps. Speaking to colleagues, we know that these are some of the areas where they're struggling potentially to get people into, kind of recruitment into those roles, into ED, and identifying, particularly volunteer to career, how these roles can support there. And we have proven models for all of them. So they come with service guides, they come with evaluation that we've done elsewhere. We know that they work, as Maxine said. That's the beauty of Adopt and Adapt. You're not kind of the first person to try it out. Lots of people have gone before. It means that we've got the resources, we've got the tools, we've got the learning, and we can share that with you. And also recognising that these roles and the scale of these roles can really help shift an organisational belief around volunteering. They are roles that are visible, they are roles that create that high impact. And, if some people are struggling to get on board within the organisation around volunteering, they're struggling to see the impact it have, these roles can really shift some of those beliefs around it. And it's probably worth saying, around the Adopt and Adapt that, we are a big learning organisation as well. Rachel has shared there how she found the platform and some of that content, and she was one of the, first to try and use that for the new blended service. As an organisation, we've looked at it and said, actually, maybe there are a couple of things missing there as well. So we've been developing new content for it over the last couple of months to make sure that we have the right content for these roles to really support you to adopt them. Can I have the next slide, Max? Thank you. So I said we'd talk a little bit about the evidence and the impact that these roles can have. So you've got 4 of them there on your screen. I won't read you through each part there, but as you can see, some of those numbers, we're talking about, tens of thousands of of patients being supported, whether that be through response volunteer tasks or mealtime companions. We have on our website the evaluation guides for, Salford mealtime companions. They started kind of smaller in 2019. They've built that up so that they're now supporting across all the trusts within the Northern Care Alliance, and on average, supporting their mealtime companions are supporting on average 1,000 patients a month around kind of feeding, and whether that be sitting with them or whether that be actually supporting them to be fed if they need that. You can also see there the staff impact it has, so how staff feel their time has been saved. Particularly, you can see around mealtime companions and volunteer to career. 82% of staff believe that volunteers allowed them to deliver good care and on average saved them 63 minutes per interaction. So some really kind of good evidence in terms of the impact it can have, and identifying where some of those main productivity gains are and where those volunteers can be of the best support and make the highest impact. So then, thinking about the Adopt and Adapt service and the why, the how to get involved, the what it means, Max has already talked you through some of the tools that we have and the platform that we use. And this is another tool that we've been using as well. So we've developed a self-assessment tool. The link that we'll give you to it, and you go through onto that self-assessment tool. It takes about 5 minutes to complete. I completed it yesterday. It definitely took me no longer than that. And it asks you a number of questions on a scale of 0 to 10 about how confident you are or the skills you think you have in certain areas. And we ask you to do that at the beginning of the Adopt and Adapt programme, so you can understand for yourself where you think some of your skills are and where some of your skill gaps might be. But also for us as a team, we can then look there and see how best we might need to tailor our support to you. Once you've completed it, you do not have to wait. It instantly pops up with your report, and you can see on the bottom kind of your screen, little screen grab of what the first page of that report looks like. But it instantly pops up with your report, gives you a little barometer in terms of like a sort of health check of where you are at the moment, and then it's got pages and pages of the answers that you gave, and then depending on what you said and how confident you felt, it's got links to numerous resources in there, guidance, information that can help to support you. That then gets completed again at the 6-month mark. So for you individually, you can see how you've progressed, hopefully, some of the changes that you've made. Really useful as an organisation to see that progress made, but for you as an individual to see kind of your progress and your development, and those areas that perhaps you were not as confident, and at 6 months later you've really developed that and developed some additional skills. So you've had a bit from Rachel, quite a lot from us about what it is and what we're looking at. So the final is how do you get involved and how would you be able to join the course? So as May said at the beginning, we're looking to start a number of Adopt and Adapt courses before the end of July. And we'd be really keen to have people involved in them. They aren't just available for hundreds of people to be on one course. We will have to kind of have limited numbers to make sure that we can run them most effectively and that we can give you the best support that we can. And we've got a link for a really quick Microsoft form so you can register your interest and tell us of those roles which one you would be interested in, whether it be emergency department volunteers, response volunteers with that real focus on discharge and how we can support people to be discharged a bit quicker, mealtime companions, and then volunteer to career as well. There are some bits that you need to be confident around Adopt and Adapt and around you being able to engage in the course, as most of our services, and those of you who've been involved in this before will know, we provide our services on a pro bono basis. There isn't a cost for them, but we do want you and us to be able to get the most out of them. So you can see there is a really brief criteria in terms of making sure that you have some capacity to be able to do the programme. You heard Rachel talking about volunteer to career, and that probably took her about a day a week, depending on the role you're looking at, depending on who else you might have to support you within a team. It might not just be you, but looking on that capacity. And we're really looking on a 4 to 6 month programme to be able to get that volunteer role up and running within that period of time. Within that, you will have the support from us in terms of those group sessions, the one-to-one sessions as and when you need them, and obviously all the online learning courses, which you can then do in your own time and then come to us if you have a challenge, if you get a blocker, if you get stuck. So I think that is hopefully everything you need to know. I'm going to bring us into the Q&A side of things. So if whatever you've heard, if you've got a question, whether it be a kind of practicality one or whether, you know, a bigger overarching question, please pop it in the chat. Mel is going to have a look through that and try and direct those questions to who probably can give you the best answer. And we've got a good sort of 10-12 minutes of Q&A, so please do ask us some questions. Thank you.
Thank you, Sarah. Okay, so we have got a few in the chat already. One from Sharon at West Herts, at Herts and West Essex ICB. Assuming this is probably for Mark and Rachel, what age range of volunteers did you get, and did any go on to get jobs?
Hi, Mark. Are you happy for me to come in there?
Absolutely, Rachel. Yeah.
Fab. So in terms of age range, it's our youngest volunteers on the programme are 16 years. And then we don't have an upper limit. I would say it's probably 50-50. So we have the demographic of young volunteers that are looking for a career in health. But we also have a number of what I call sort of our mum returners. So people that perhaps have been out of work for a length of time because they've gone on and they've had their own family, and now perhaps they're looking for a change of career. So we have sort of a demographic of people in their 30s, 40s as well. Maybe they just wanted to, you know, try a career in midwifery before sort of applying for a paid job or a course, that sort of thing. In terms of how many have gone on to get jobs, there's still we're still in sort of our active delivery phase, so we haven't yet got that data. But during the first cohort, we've already had 2 from our first cohort successfully gain places on midwifery degrees to start September. So I can't answer about the jobs yet, but certainly 2 are starting in September on midwifery courses. I hope that helps, Sharon.
Thanks,
And
Rachel.
just to add on a national basis, you know, in terms of the volunteers, 35 to 44-year-olds from a sample that we surveyed across 3 sites in northwest London, with the oldest with the age demographic participating on the VTC programme, followed closely by 18 to 24-year-olds. So we are capturing, you know, quite a wide range of age groups.
Thank you, Mark.
We also know, sorry, Mark, we also know from our previous cohorts the national statistic for people moving into jobs or training, don't we?
Yeah, sorry, Meg, we do. Yeah, so from cohort 1, proof of concept, 73% of volunteers who participated in the programme embarked on clinical training or secured employment. Yeah, quite a good conversion rate.
I have a request here from Karen at Cambridgeshire Community Trust. Could Rachel please share her volunteer role description? And could you describe how the pathway for volunteer to career differs from that of people not on a V2C pathway?
Absolutely. I'll put my email address in the chat box at the end. So if anybody wants to contact me, I can send across a volunteer role description. In terms of the pathway, how it differs to other volunteers, the rest of our trust volunteers, this is more about the added benefits that we can provide on the V2C programme. So that's employability support, access to CV writing workshops, interview skills seminars. We've held Ask the Expert Q&As, and that dedicated clinical lead mentor along the way, which is my colleague, another Rachel. So that's how it differs. It's that extra sort of arm around the shoulder and support that hopefully will lead these volunteers to be able to either gain employment at our trust or go on to further education. I hope that helps.
Thank you. Question from Rashpal regarding V2C Adopt and Adapt course. Is this different to the mentoring programme for clinical leads? Possibly one for Mark or Max there about differentiation between the new Adopt and Adapt programme and the clinical support.
Yeah, should I jump in there? Rashpal, I guess it's a hybrid, always with the volunteer to career element. There will always be an element of it's the clinical, that the mentoring that you're talking about will still carry on for clinical leads. as far as we see it, and actually be the clinical leads that will be embarking on the program, the online program that we've just spoken about.
Thanks, Max. Brash will jump in if you have any other questions around that. Susan Friend, will there be a program to support adopting a young volunteer program in the future? So will you be focusing on the 4 programs that you've mentioned today?
Susan, it'd be helpful to know what you mean by adopting a young volunteer program, as in a service that's for young volunteers or for volunteers supporting young people. That would be helpful. But so do pop that in the chat. But basically, these 4 are our initial focus, and we will be opening the door for more services later in the year. And I think one of the reasons why, again, that sort of links to what Sarah was saying, is some of these high impact services are so important to get in now, ahead of winter pressures and that sort of thing. So that's why as another reason why our focus is that, as well as you guys sort of telling us the demand. But if you give us a bit more info about the young person's bit, and we can get back to you.
Thanks, Max. I can just see that Susan's written into the chat, as a hospice, we have a lot of roles that are not clinical based, and we're keen to adopt a young volunteer program across our organisation. Might need to pick this one up offline.
Yeah, we'll take that one offline.
I've got a message in here, unknown name. I think this is a good question for you, Max. I'm getting from this message that this person works in a small charity. They do work closely with community and NHS organisations, and they work in eating disorder services. Are they still able to access this platform, given that they're not in a clinical setting?
Absolutely, without a doubt.
I thought that'd be the case. It's open to everybody, not just people in acute
across
settings
the
and NHS settings. Yeah. Okay, thank you. And that was from Diane. Thanks, Diane, for adding your name there. I've got one from Bobby. Is there a rehab focus on the discharge volunteer pathway work? Because this is a key element.
Bobby, do you mean on the volunteer to career pathway? Is there a discharge focus, or generally?
Either.
The cohort of people or the environment or the context that you're working in doesn't matter at all. In fact, some of the skills that we help you develop as part of this program is how to take an existing model and identify, well, think about what you need to consider to tailor that to meet the needs of your local context and environment. So actually, whatever your people that you're working with, whether it's community, whether it's in a hospital, whether it's in a charity or a hospice, or it's with rehab, or whatever those complexities, actually the course is about helping you understand how to make adaptations for your environment.
Thanks, Max. I am not getting any more messages through. I think we've covered them all in the chat so far. Feel free, anyone, to raise your hand if you want to ask a question now live. And thank you, Becky, for reaching out to Diane. Becky works within adult eating disorder services as well.
Okay, I think that's probably it for questions. It is also it in terms of the content that we wanted to share with you today. Thank you all so much for staying the length. We sometimes notice when we run these webinars that the numbers drop off when it comes to the Q&A, but I see most people have stayed. So hopefully that demonstrates that what people heard they find helpful. And I suspect, as always with these things, when you go back into your day job, questions around things we've said will come to the surface. So please feel free to contact us, and we'll answer any of your questions retrospectively. So all that leaves for me is to say thank you all very much for your time. Please fill in the form if you want to register your interest. And I said in the beginning, unless we hear otherwise from you, we'll assume that you are happy for us to make contact with you later on about any or all of the opportunities that we've talked about today. So thank you all very much, and we'll let you get back to your day.
Thank you.
Thank you.
Thanks.